Well, hello. Welcome, welcome, welcome. Thank you so much for joining me this nice Sunday, late afternoon, evening. I'm Dr. Sylvia. I'm a consultant in general practice. This is AskAwayHealth, and I'm so pleased that you've clicked on this video where we're going to be talking a little bit about birth control issues. But how have you been? How was it last week for you? How has your Sunday been? Um, I'm really glad that if you this is a subject or topic that interests you, that you've just decided to spend a few minutes of your time. And it's also the first time that I'm live streaming on the Facebook and LinkedIn. So I'm feeling a bit excited about this and seeing how things work. Hoping technology stays and behaves itself as well. But yeah, let's see how it goes. So, my background is in general practice, but I have an interest in women's health, sexual and reproductive health, and family health. And on my channel, for those of you who have watched a video on my channel before, you know that we talk a lot about birth control issues. But I feel like it's been ages since I actually discussed any birth control issues, and I keep getting questions around the subject. And I think one of the most popular ones at the moment is around I've been using I've just come off the pill or I've just come off the depo shot and I've been using it for 5, 6, 7 years. And yeah, my periods haven't either my periods haven't come back or I've been trying and I've not been able to get pregnant. And so the purpose of this video really is to look at this issue of return of fertility after you've been on the contraceptive pill, contraceptive depo shot or patch or implant or coil, any of those hormonal methods. What is the impact? What's your experience? So if you're here and this is a subject that it directly affects you because you're asking yourself that question, please let me know your thoughts in the comment section. I'd really appreciate to hear back from you. Or if you want to share your experience, that would be absolutely amazing. Also, a reminder to please give this video a like, of course, if you find this information very useful. And of course, consider sharing with a friend or somebody in your network that you think it might be useful for. This is also a good time for me to remember to put up my disclaimer where I remind you that we are not doing medical consultations or health consultations here. We are talking about different health issues that impact us as individuals and just trying to provide a bit of information and education to signpost you to your own healthcare provider where you can then go and have a more what's the word now have a more detailed and comprehensive discussion assessment, and then they can guide you on what is most appropriate for you. I can't consult with you here on Facebook or LinkedIn or YouTube. Wow, this is really exciting. I don't know why I didn't start this sooner. Anyway, so we are looking at being on the pill for several years, and increasingly this is what is happening in different societies. Women are starting the pill and staying on it for longer than 6 months or 2 years. Women can stay on the pill for 7 years, 10 years, even longer than 10 years. And so for those who start it before they've had their family or they started having children, if they stay on it for several months or several years, the question will at some point be, how could this affect my chance of having children, of getting pregnant? And like I said, I do have experience of quite a number of women who are asking that question, worried about experiencing delays for one reason or the other. And we want to look into this now. We want to look into this in detail. So I've put up some slides, as I tend to do. For those who are new to my channel and my system, when I do my lives, I do tend to put up some slides, some images to help talk us through. There's none complicated today, just a few questions here and there. But I think this will just help us to get into the frame of mind. So, which of these women are you? Which of these women are you? Could it be because you've not met the right person, so you're not really ready to start having kids yet, or because of work, or because of so many different reasons why it's taking longer, or while you're not ready to start, having kids, and so you're staying on your contraceptive method longer perhaps than you planned, certainly longer than 5 to 10 years. Or are you in the situation where you've come off the method already and you used it for 10 years? Oh, and I should mention as well that it's not just for the purpose of birth control, because we tend to just think that automatically. There are other reasons apart from trying to prevent an unplanned pregnancy that women will use the different methods of contraception like the pill. So it could be things like irregular bleeding, excuse me. It could be because you want to control periods that are sort of, out of whack. They're heavy, very heavy periods, or an irregular pattern. It could be because we're trying to control that in conditions, for example, PCOS or endometriosis and so on. So there could be different reasons why a woman will start on a birth control method, apart from trying to prevent an unplanned pregnancy, and then continue with that method for a prolonged period of time. And the issue of time is it's I think it's subjective. For some people, 2-3 years, depending on when they start and why they're using it, it could be a couple of years, and then they come off the pill or the method and then go on to do whatever they want to do. For some people, it could be longer, and I've said why it could be longer: work related. It could be a medical condition you're trying to treat. It could be you're not ready, you've not found the right partner, and so on and so forth. Let me know in the comment section what your experience. Let's make this interactive. Don't let it be me just doing all the talking. Okay, and if you're just joining in, hi, it's good to have you here. Please say hello. I know lots of people like to sort of sit in the background and listen, and I appreciate you popping in. That's great. It would be nice if you actually sort of said hi as well. Let me know where you're watching from. And of course, if you've got a question, that's perfectly fine. So we're going to get started with this. And so the question we're asking ourselves is, how can long-term use of the birth control pill, and I'm using the pill specifically, but a lot of this could also apply to other hormonal methods, because we tend to have the same hormones within them, just in different strengths and in different combinations and so on. But the question is, how can long-term use of the birth control pill affect your fertility chances, and what are the ways that we can address them? So the first thing I want to say, okay, and this is by way of studies that we have, this is by way of research that's been done, is that the long-term use of the pill, the mini pill or the combined pill, is not thought to affect fertility significantly for most women. So when you ask your doctor this question, most of the time he will tell you that using this method and its effect on your fertility is reversible. It's temporary. Okay, so you go on the pill. We know that the way the pill works is to suppress ovulation, so that you are not ovulating or releasing an egg naturally. So that's what the job of the pill, or whatever hormonal method you're using, is to prevent that natural event month after month, where your body will release a mature egg. The pill that you're taking, or the hormonal birth control method that you're using, stops that from happening. So that's only temporary, because when you stop the method, your natural pattern will eventually resume. So that taking the pill day after day, or using the whatever method it is, whether it's a depo shot or whatever, when you stop that method, your natural cycles, your natural pattern, the way your body naturally produces hormones, should return back to normal. And that's what happens in most cases for most women. But there are some women who do not have that experience. And I want to be very honest with this, because even though we say that using the pill long-term should not affect your fertility, some women still have an issue. What is going on? And sometimes perhaps it's taken for granted that all of us women will not have the same experiences, and so everybody should be treated as an individual. So we're looking at different situations. We're looking at what could be responsible and what could be going on. So I'd like to start first of all by looking at what happens to your hormone balance, and potentially what are some of the long-term effects that you might have. And now this is not that stream where I'm looking at discussing the side effects of birth control methods. We can do that in another stream. I'm specifically looking at, you've been taking them for a long period of time, and I've given between 7 and 10 years as my benchmark, 7-10 years and over as my benchmark. And so what I'm saying is that you may experience certain things, for example, hormone imbalance and other long-term effects, because of that period of time that you've been taking the pill. So like I said, the pill introduces these human-made hormones, estrogen and progesterone, into your system. And when they're introduced into your system, they put your ovaries to sleep, so that your own natural hormones are not being produced, and you're not releasing any eggs. Any bleeding that you have while you're taking the pill is as a result of a slight withdrawal when you sort of go off the pill for your pill-free period or whatever, and the effect of that withdrawal on your womb lining, and that sheds a little bit of blood. It's an artificial period, if you like. Your natural system, your ovaries, your everything, they've just been put to sleep. I think is the best way, because they will wake up. Okay, they've not been permanently hampered. They've not been permanently destroyed. No, they've just been put to sleep for a period of time while you're on this method. Okay, so over time, as you continue taking it, your natural hormone production is suppressed. And so what happens when you come off it, what happens when you stop taking the method, is that you will probably experience some imbalance. You know, it will take some time before your natural, I've been banging on about your natural cycle. It'll take some time before your natural cycle resumes. Guys, please join. If you're joining, please give this video a like. I do appreciate everyone coming in, checking out what we're talking about. And I would really love it if there's anybody that you think would find this information useful, worrying about using the pill, or using any birth control method, and concerned about fertility, worried about why is it taking so long. Please share. This is what we're talking about today. And I'd love to see your questions around the subject. While I can't give specific health advice or direction in terms of your own personal situation, we can sort of talk around it and maybe suggest some areas that you can have conversation with your own doctor. So hormone imbalance, that's where I was losing my train of thought. So hormone imbalance is something that, you know, many women would experience as you come off the pill. And at that point, your ovaries start to wake up, and they're not just going to, you know, you've been fast asleep and then all of a sudden the alarm rings and then ovaries are awake. No, that's not how it happens. So there is, for a variable period, variable meaning that it's different from one woman to another, the level of the hormones starts to go up, and they go up and down, up and down, up and down. It's not a sort of smooth, just from 0 straight to 100 within X days. No, it's sort of gentle up and down, bobbing up and down until it sort of gets into the phase, into the levels where ovulation will happen. So expect to experience some hormone imbalance as you discontinue your pill. This should help you put, sort of put things, help you put it in perspective, help you cope with the uncertainty, and, help you sort of deal with the situation. Don't feel as if, oh, something's wrong, because really nothing's wrong for most of us, or most women who are in this situation. It's simply that your body is just trying to get itself back on track. Okay, so that's the first consideration. Of course, as a result of this, your periods might be irregular, you might have issues with your skin or your hair, and all this is simply as your body adjusts. There might be issues with mood swings, and I'm talking about you've been on the pill or your hormonal method for several years, you've come off it, presumably you're now ready to get pregnant, you're ready, things are in the right place and you're ready to get pregnant. So you might experience changes to your mood, even mood swings, which some women have commented on. Changes in feeling, I hate to say feeling emotional, but what I'm really referring to is just sort of quickly going from one place to the other and not understanding why you can't sort of keep check on your emotions or feelings. But women can experience this kind of mood swings because of the hormone levels fluctuating. They're not at a level place yet. They're still sort of trying to build. Okay, some women might experience, and so we're talking about possible side effects that women might experience as they come off that method. Some women might experience changes to their libido. It all depends on what it was while you were on the pill. Some it might just remain as it was. Some they might experience changes to libido again because of the hormonal imbalance, and this is the potential effect on your sexual desire, satisfaction. It might take some time before it returns back to normal. I do have one or two videos around the subject of sexual desire, and it will be good if you this is an issue that you want to look into further. Please head over to the to my playlist on playlist on different types of contraception, but I will link this in the description of this video once we're finished. So other possible side effects that may have an impact on how you feel and how you are after taking stopping your pill could be the effect on your weight. Now, this one is a controversial one, but I want to bring it up front because somebody is going to come and say to me in the comments that I didn't talk about weight changes. Now, it is valid that many women do say that when they're on the pill and some other forms of birth control, they feel that it affects their weight. In other words, they are concerned that it leads to weight gain. I say it's controversial because studies that we've done haven't exactly shown that direct relationship. That it is the pill directly that causes the weight gain. Perhaps it may have something to do with the studies and the way they are designed, or perhaps there isn't actually any association. But the fact is that there are some women who feel that this is the case for them, and if that's the case, then clearly, if they're having difficulty in losing weight after they've stopped the pill, that could have an effect on their ovulation, because you know that being overweight can affect ovulation. We also know that it could affect your self-image. It might affect this sexual desire as well. So those are some important things to think about. So we're just looking at the first aspect. I've got about 3 or 4 different things. There are probably more, but I just picked about 3 or 4 different things that women who have been using the pill for several years and are thinking of coming off it, or have just come off it and are thinking, oh, when am I going to get pregnant, should consider. Most of the women, especially if it's the pill, most women who've used it for 10, 15 years and they want to start a family, most of them, the experience is that they quickly regain their fertility. But there's some who do not, who have experienced a delay. And that's the little group of people that I really want to talk to today. So we've just considered the first thing. We've talked about what happens to your hormonal balance, and I've established that it is irregular. I want you to understand that there will be, for some time, until your body gets back into its natural pattern, there will be some imbalance of your hormones. Okay, so the next thing, and this is the big one, what happens to your fertility and reproductive health? Okay, this is the one that, of course, is very concerning, particularly if you have come off the pill, and you want to, particularly if you've come off the pill or the method, and the next step is that you want to, start having children. So, the first thing to say is that it might take some time to return to your normal fertility. That's the first thing to say. It might take some time. Time is so important. Time is so important. And I don't know if we say it enough. I'm just trying to think in my own case, when I have a consultation and, we're having a chat. It's not something, honestly, it's not something that you discuss when you're starting the method. Really, it's not, because those are not the key things, I admit, that we'll be discussing when we're about to start the method. Of course, it's more relevant when you're thinking of coming off it. So it's part of that continuous assessment that doctors will have with our patient doctors and nurses, and even pharmacists, for example, here in the UK, when women can go and pick up the pill from the chemists and the pharmacies. But it's a conversation that us clinicians need to be having regularly with our patients as we provide them this medication, and especially when they are looking at coming off it, and what is the expectation. So there could be a delay in return of fertility, and it again is variable. It's usually fairly quick when we're talking about the pill. So that means that when you stop the pill, for many women, usually within a few weeks, less than 3 months, they have returned back to normal for many women. But like I said, we do have a proportion of women for whom that's not the story. And of course, the people who have used or who know about the depo shot will know that that one can be related to a very lengthy time from stopping to when your fertility returns. Okay, so some people could be 6 months up to 12 months, even longer. There's nothing wrong with you. There's nothing wrong, but it's just that your fertility hasn't resumed. And we can't say that during that period you will not fall pregnant, because nobody can really predict it. But many women will experience after they've stopped their injections, will experience that delay in fertility. And I think that's probably one of the really common questions that I get. So going back to the pill, after stopping, some women might, get pregnant almost immediately. Others might experience a delay. Again, to emphasize that the pill itself those hormones do not have a long-term effect on your fertility. It's reversible, it's temporary. So it's a call for patience and understanding, and just keeping track of what's going on in your body. And if anything seems unusual, to speak to your doctor about it. And just encourage you that during that time while you're waiting before your natural cycle, your fertility returns, maximize on things like keeping yourself healthy. You're getting ready for a baby, so keeping yourself healthy, whether it's exercise, making sure you're having some regular form of exercise, a good healthy diet that will start to build up the nutrients that you need to support yourself as in your pregnancy. Stop smoking or avoid smoking, avoid alcohol or excess alcohol consumption, and different things like that. Start thinking about supplements that that you can take, because you're just trying to get your body in shape. Your fertility will return. We're not going to blame the pill when there is no evidence to suggest that it is doing anything apart from causing a temporary halt to your cycle, which will stop once you've finished. But in that sense, I need to mention this, and this is something related to, so what are we talking about now? We're talking about, we finished hormone balance, we're talking about fertility. But in that sense, I need to talk about something that we might miss, and is masking of certain conditions that were present before you started the pill. And I get this from women who say, I started the pill and XYZ amount of time passed, and then I discovered I had PCOS. And it's as if, it was the pill that caused the PCOS. And we don't have any evidence for that. I know that some people will come back at me and say, it's all these hormones and things that cause all these problems. I hear you. But actually, what most likely has happened is that the PCOS was there, but it wasn't picked up at that point, because probably in a younger woman who wasn't really about to start having children, or she was having irregular periods, and the thinking was that, it's a young person, her natural cycle hasn't achieved the balance that it should. So it is not abnormal to have irregular periods at that point. And so the solution sometimes would be to use the pill to try to bring that balance to the cycle, so that a woman or a young girl who's trying to go to school or go to work is not sort of suddenly waking up, with a period, and then maybe for a couple of days, and then it stops, and then after 2 weeks the same thing again, and there's no pattern, she doesn't know what to expect, and so on. So you try to put on the pill to regulate that, which we commonly do. But what if the reason she was having those sort of funny irregular bleeding, what if the reason for that was because of PCOS? So we would use the pill and mask the condition, so it just hides it. It doesn't go away, it just hides it. And then when it eventually stops the pill after 10 years of being on the pill, and so she's now settled, she's finished whatever she was doing, or she's just ready with the right partner to settle down to start having a baby, then it is clear, because she's not falling pregnant, the menstrual pattern is irregular, and by the time you do the tests, you work out that this is caused by PCOS. So it's not that the pill caused it, it's just that it masked it for the period of time while she was taking it. And not just PCOS, other conditions like endometriosis, that you might use the pill to try and control the bleeding, you may have this experience. So there is that, being aware of the return of fertility when you've stopped taking the pill. And then the other thing I want to mention is this whole issue of ovarian reserve, and the question of, the pill is affecting the ovarian reserve, because actually it doesn't. If you think about it, every time you menstruate, you are you've actually lost a few eggs. And as a woman gets older from month to month to month, she's losing eggs. So from birth, a woman is born with all the eggs she's going to have, and as she grows, gets into menstruation, all the way to menopause, eggs are just being lost month after month after month. So except when you're pregnant, or when you're on a method that stops that ovulation temporarily. So actually being on the pill is actually helping to keep the ovary from releasing those eggs. But the amount, even if you're on it for 10 or 15 years, the amount that the body holds on to because of the pill, the amount of eggs is small compared to the amount you lose in your lifetime. So it doesn't really make much difference. So the point I'm trying to make is that no, the pill does not is not responsible for attacking the amount of eggs you have in your ovary. There are still studies being done. That said, there's still studies being done where we're looking at, okay, the pill works by preventing ovulation, but does it affect the way the ovaries respond when you stop taking the pill? So there's still studies being done on that. We don't know the answer 100% on whether the ovaries were responsive at about 100% normally. Then when you've been on the pill for several years, that responsiveness comes down, which could affect fertility. So that question is there. It's a good question, but we're still trying to work out the answer to that. The other thing as well to think about is that using the birth control pill for a long period of time may even affect how well the ovaries can release those eggs. So could it do something? Could it make it less effective at doing it? These are still questions. We don't have the answers to them. But we do have a large number of women who are able to have babies after they've been on the pill, who are able to fall pregnant after they've been on the pill for several years. It has not been an issue. Okay, so we tackled two things. We tackled the hormonal imbalance, and we've also looked at fertility. If you're just joining me, grab a drink. If you're just joining, welcome, welcome. I'm Dr. Sylvia. I'm a GP based in the United Kingdom, and I'm just talking about women who experience delays in the turn of their fertility after they've been on the pill or other hormonal methods for a very long period of time. And very long period, I use sort of 7 to 10 years and more as a description. So the other thing I thought was really important is your mental health when after you use the birth control pill for a long period of time. Remember, I've said this at the beginning. Let me just repeat that for those who may be joining midway. Most of the women who use these methods and come off them, their fertility returns. We don't have any evidence that the methods like the pill, patch, or the coil do anything apart from a temporary suppression of your fertility. It's temporary, it's reversible. So we don't have any evidence of, anything more than that. But I do know that there are many women who do experience delays, and the delays, there could be, medical reasons for the delays. For example, PCOS, like I was just saying. But there's some women who do not have that condition but are experiencing delays. And so what is it? Why? What are the possible reasons? And what could you do? That is what we're trying to address. So the next point I wanted to talk about was regards to mental health and emotional well-being. Just like we talked about libido, we talked about weight gain and possible side mood changes. Let me just elaborate on that because it is one of the recognized side effects that some women may experience a change in their mood, anxiety, or depression when they're on the pill. It may be something that settles, or it may be something that persists after they stop using the method. So being aware of it, because it's so important, your mental health and emotional well-being is so important, especially today's world that is so busy, so full of different things that we're doing, different stresses and issues that we have to deal with. It's important to be aware of it, that you've been on these hormones for several years and potential effect they might have on you, either for being on them for a period of time or as you come off them. So being conscious of your mental state and recognizing when things begin to change and coming quickly to speak to your health practitioner is really, really important. But even more so than that, and it's something that we really need to talk about, ways that we can de-stress, ways to recognize when we are taking on too much, if you like, ways to things to do to be kind to ourselves, especially in terms of our mental health, but also to recognize when we're in trouble and speak to a medical practitioner as soon as possible. I think I've mentioned it already. The key thing in terms of preparing yourself, you want to have a baby, you want to fall pregnant, regular exercise. I didn't mention sleep, and I don't know why I forgot that, but sleep is so key. It is all part and parcel of those things that you have to put together, that healthy lifestyle you need to put together in order to stay well. And sleep is essential for good mental and physical health. Okay, so We have just been talking about mental health, and I think the very next one is your general physical health. This we take it for granted, this particular one, but I think it's really important. And it might surprise you to know that taking the pill cooled affects how your body absorbs certain types of nutrients, and especially long-term use in particular, and especially if you're not careful about what you're eating and if you're not watchful. And as you grow older, you might be at risk of some nutrient deficiencies. But the fact is that a lot of nutrients are essential, like vitamins B6, B12, folic acid, magnesium, zinc are really essential for the way our bodies function. And there might be signs like being anemic, feeling tired, a weak immune system. This might suggest that you're imbalanced with these nutrients. But how is it related to the pill? Well, the pill is broken down or metabolized by the liver, and the liver also metabolizes some of these nutrients. And it may be that the the activity of the liver may lead to faster breakdown of loss of those other nutrients. It may be that because you're taking the pill and there's higher activity within the liver to work on breaking down those hormones, it may lead to those essential nutrients being broken down as well. So then there's that possibility. Like I said, it's not for everyone, but you do find that especially after you've completed or you've come off the pill, there might be some instance where you're not absorbing nutrients as effectively as possible. It's just something to keep in mind. And so the question is, if you're sort of starting to feel very tired, fatigued, you can't explain why, you just haven't, got the motivation, or you're getting very short of breath, it's worth having a conversation with your doctor. Blood test to check what your hormone, your levels are, for example, B12 if you're short on that, or magnesium, and also check your hormone levels to see. In some cases, they might be able to check to see if there are any hormone imbalances like your thyroid function and so on. It's worthwhile having that discussion. And it ties into what we've said about healthy living, considering that you have a healthy lifestyle, pursuing the things that you should, like eating right and sleeping well, things that you should as you're preparing your body for having a baby. So at the end of the day, this is where we're trying to get to. This is where, as a woman who's been using this birth control method for a prolonged period of time, this is where you're trying to get to. You want to have a baby. The first thing that I would want to emphasize is the importance of time. If, first of all, it is the right thing, or what we know from studies is that the methods like the pill, even the implants, or even the coil, all these hormonal methods, that pretty much within a few days or even weeks of stopping the method, your fertility returns in most of the cases. The only one that we know there is a delay, a significant delay for some ladies, is with the depo shot, okay? But all the others, it's pretty quick. But there's some women who, like I said before, may experience a delay that they don't understand, can't explain it, what's going on, why haven't my period started again, why can't I get pregnant? And what I'm saying is, please be patient, and it differs for all of us. It differs for all of us. Some of us have periods, menstrual cycles that last for, you have a 28-day cycle. Some of us have a 21-day cycle. Some of us have 30, some have 35, and so on. And it may be that within that sort of range, there are some of us that will return, our fertility returns quickly, while some of us experience a longer delay. If there are no obvious symptoms, if there's nothing else that seems unusual going on, then giving your body time just to recover is good. It doesn't stop you from going to have a conversation with your doctor to say, I'm concerned about this, and express that, well, you've just come off the pill or whatever method, after using that for 10, 12, whatever years, and you're worried, you're wanting to start a family. There's nothing wrong with having that conversation. Might be the time that they want to do some tests to check that everything's okay, that you're not anemic, check your vitamin levels and so on. That might be a good opportunity to do that. But I really want to emphasize time as really important in the conversation. Of course, we've mentioned hormone balance, and that's why it's up there on the list of things that you need to think about, have in the back of your head that is relevant in this conversation. Be aware of the fact that as you've come off that method, that birth control method, your hormones are imbalanced, they're out of balance. They need time to come back to the natural pattern, a natural menstrual cycle that will lead, that's associated with ovulation, which is what you need for pregnancy. Be conscious of mood changes in the sense that it might affect this is the effect of coming off the pill. So it might leave you feeling, anxious or depressed simply because it's continuing effect from the pill. Or it might be, difficulty. It might be associated with the next one, which is your sex drive. So it may be that you're not in the mood, and of course that will affect the chances of getting pregnant. And I think the important thing is being aware that it's a possibility, so that it's amongst the things that you will discuss with your practitioner. I've said it so many times in this session, healthy lifestyle. I'm not going to repeat it again for you, but it's down there on the list. Things that need to be in the mix for you to come to that point where you're carrying your own, your own baby, having used the pill for several years, and then come off it. You're looking for pregnancy. Healthy lifestyle. We talked about masked conditions, people who had PCOS, they didn't know they had PCOS, for example, and they stopped taking the pill, and things are not happening. It's important to go and have the tests, usually blood tests and a scan that will tell if PCOS is present, and then you can have whatever treatments depending on the kind of symptoms that you have and depending on what is going on at that point. And of course, the last one is ovarian reserve. We talked about how trying to dispel the feeling that, it's the pill that will affect the quality or the number of your eggs. And we said, look, we don't have the evidence for that. It is true, there's a study that indicated that the AMH anti-Mullerian hormone level is lower while a woman is on a contraceptive pill, but that effect is temporary, because when she comes off it, then things will come back to normal. But it's good to be aware that as you age, your ovarian reserve is depleting. That is simply the course of nature. It is simply what is going to happen to everyone as we grow older. But the pill or your birth control method is not going to render you infertile because you use it for several years or because you've taken it for that length of time. So, of course, that said, it's a lifestyle choice. You choose to stay on the pill, you choose to remain on it, or whatever method for as long as you do. It's important that you're being in check with your medical practitioner, being conscious of your own body, changes to your body, changes to your period pattern, to your mood, checking your breast and all the different things that we encourage you to do. Because as women, we're on a journey. Our bodies change as we age, as we grow older, and from menstruation to being on the pill to pregnancy to menopause and so on. We're on this sort of journey that our bodies that we're going through with our bodies. So it's important to be aware of them and keep track with your doctor as any changes evolve. Guys, this is what I wanted to talk to us about. It's been a short and sweet one. Thank you so much. I wanted to let you know that if you've got any questions that you wanted to send out on this particular subject, you're very much welcome to do so. I will direct you to I will direct you to my website. Let me just share the screen with you. If it will let me share this, not letting me share the screen. Hang on. Let me just share the screen. So let me show you where you can go to. I hope it will. I'm not sure if it's sharing. Let me just close this. So this is the. Okay, yes, it's sharing properly. Okay, let me go back. So yeah, so if you wanted to ask a question around this subject, you can of course speak to your own provider, or you can come to our website, AskAwayHealth.org, and scroll down just to the middle bit, and here is the Ask Me a Question bar. You click on that, it takes you to the email health service, and you can send an email with your inquiry. You can attach some images. Just simply follow the instructions. It's a paid service, but it's one that's very responsive. We'll get back to you ASAP and provide you with information that you might need with regards to that particular situation. Of course, I would also encourage you to go and check out our YouTube channel, because a lot of information is on the YouTube. I do so many health information videos. I'm just going to share that as well with you, especially for those who are from LinkedIn and Facebook. We share. Ooh, I don't. Okay, so we share lots of information. On there, I've got playlists with so many different topics and conversations that we have. Advocating for our health, how to get pregnant series, responding to your questions, PCOS, menopause, birth control, vaginal health issues, fibroids. Oh my goodness, there's so much, just thinking about all these things that we've done over the years. But yes, I do invite you to go and check them out. Guys, thank you so much. Thank you so much for being with me tonight. I appreciate that. Please give this video a like. And next week, we're doing something similar, but I really think I want to talk about menopause in that session. So if there's something around menopause that you're curious about or been wondering about, please send it through to me via my community post, or you can use our email link, which I'll leave in the description box for this video. There are different ways that you can get in touch around the subject. But thank you so much for listening. I'm just going to pull this up because I just realized that I've not stopped sharing. Yeah, there we go. You can see my face. Thank you so very much for watching. I hope you have a great week, and I will see you again real soon. Take care, guys. Don't forget to like, and of course consider subscribing, and I will see you again real soon. Bye bye.